You don't think about this until it actually happens in your family. When it does, it's frightening, and you realize things are going to change in a big way.
I had worked all day. We had had our normal Friday night dinner with our kids and our grandkids. That was a normal thing, and everything was fine.
When I first noticed there was a problem, she would wake up gasping for air. After 42 years, I think I know her pretty well, and I knew this wasn't a normal snoring issue.
Steve kept coming in and trying to wake me up.
Pretty soon I would hear her gasp again, and I would go in and have to shake her and to help get her to come around. I knew then that this was getting very serious, and so I went ahead and called 911.
The next thing I remembered was we were screaming down the highway. I kind of looked at the EMT and she was asking me, "Are you all right?" And I said, "Yeah." And she said, "I just had to shock you."
When we got to the ER, I walked in the room about the same time as my daughter and my son, and I heard them saying, "Charge, charge."
And I could see Steve across the room and my kids. And then the next thing I could hear them saying was talking about getting me to the cath lab. And I knew when I heard that it wasn't good, something was wrong. And, sorry. And they had the kids come over to see me because they were getting ready to put me under. That was frightening. I didn't know if I'd ever see him again.
My name is Eric Putz. I'm a cardiac electrophysiologist at Salem Health. The cardiac conduction system accounts for maintaining your heartbeat. The health of the conduction system looks very different when we're in our 20s than it does when we're in our 50s and 60s. Brenda had a situation where she would have the spontaneous initiation of life-threatening rhythms. She has PVCs, which are extra beats in the lower chamber. It just so happens that they are timed in a part of the cardiac cycle where it's a vulnerable period and initiates a life-threatening arrhythmia. We implanted a device called a defibrillator. Fortunately, Brenda's done great with the medication to suppress the arrhythmia that is at the root cause of the problem.
I felt very safe, very comfortable in the care team. I trusted them.
It takes a team to take care of patients like her. None of us in my position could do what we do without a team to support patients like Brenda.
At one point, one of the nurses asked me if I knew Dr. Putz, and I told him no, and asked why, and he says, because he hasn't left the nurses' station since we brought you upstairs. They said he stayed there all day. It was a Saturday. On Sunday, they said he called every 30 minutes checking on me. That's amazing to me.
Brenda lives with a daily awareness of she's okay, yet she also lives with the awareness that she has a device implanted in her body that's going to require maintenance for the rest of her life.
I go every 6 months as of right now to see Dr. Putz. Medications are working well. He's happy with everything. I feel normal. I do all the normal things. I don't have any restrictions anymore.
Are you feeling much in the way of palpitations?
No, I don't feel anything.
Feels quiet?
Yeah.
Any problems with the monitor?
Nope.
Everything's going okay?
Yeah. Because they're with me on this, I can do everything I was doing before. I love spending time with my family, my husband, my kids, my grandkids, doing all those regular daily activities that we all take for granted. I don't take those for granted anymore.
And you did it looks like. Not sad about it.
Brenda is a great example of the fact of what she is able to do, how she approaches her life, despite the burden that she lives with of a chronic medical illness.
I am so grateful for everything that they have done.